hospital capacity is at a breaking point.
We've really been really beyond what the comfortable capacity has been for several weeks now. And I think that the next concern is, do we have to go into what's termed crisis capacity?
Local physicians say they're worried they may have to start triaging healthcare resources. They say that when hospitals are at capacity, it's patients with non-COVID related needs that suffer. Earlier this month, Governor Ricketts announced the Transfer Center for Hospitals. The 24-hour call center works to locate available beds for patients needing a higher level of care. Columbus Community Hospital says the center has worked fairly well for their organization, but many medical centers are full of non-COVID patients and unable to accept their transfers. Other hospitals, like Bryan Health, say it's not working.
To be rather frank, I don't think it's working out as well as intended. The previous time it was opened, it was kind of managed by CHI, actually right over in St. Elizabeth's, and now it's being handled by Naomi, the company that was behind Test Nebraska. And there are some issues.
Physicians say the call center's ability to transfer unstable patients simply doesn't exist.
They're not being helpful in the transferring of and finding a home for unstable patients, which obviously many of the COVID patients were the type of transfers that happen to a tertiary center like Bryan are typically unstable in one capacity or another.
In a statement to 3 News Now, Nebraska Department of Health and Human Services says if a patient has been determined that every second matters, transport might pose a delay in treatment that would likely result in a fatal outcome, and the center will not transfer. They add a patient can be in critical condition and still stable enough to transport. Reporting in Omaha, Alyssa Curtis, 3 News Now.